This conference will now be recorded.
Good afternoon, everybody. Thank you for joining. My name is Ken Voll. I am an RHIT and I'm part of OHIMA, and we're going to be talking about the denials management process today. A little technical difficulty. So let's start off with exactly what a denial is. So a denial represents the payer's process for not paying a claim submitted by the provider due to missing information necessary for adjudication. It does not mean that the claim is fraudulent or it is material or false. It means that there is information not present on the claim form to receive expected reimbursement. A denial can have negative impact on the provider's cash flow, as delays in expected reimbursement become outstanding accounts receivable and could potentially result in bad debt and can risk the provider's ability to provide patient care. It's the responsibility of the denials management team to address these accounts and minimize potential associated risk. So denial, rejections, and what's the difference? So there is a difference. In general terms, a denial and a rejection occur at different points in the claims process. A rejection occurs prior to claim acceptance by the payer and are not assigned a claim identifier in the payer's system. These claims must be fixed and resubmitted as quickly as possible to avoid initial submission timely filing limits, which are normally between 30 to 90 days. Reasons for rejections are claim demographic issues, for example, invalid ID number formats, ID normally containing 9 digits, however, there's only 8. The other reasons for rejection is the file does not match either the payer or clearinghouse rules for submission. An example of these types of transactions are incorrect bill type or a needed qualifier is missing from a claim field, for example, the date of injury. A denial, on the other hand, is accepted into the system for processing and is assigned a claim ID. Reasons for denials vary based on the payer's rules or other issues that the payer deems to be the reasons not to pay a claim. Normally a time limit for resubmitting a corrected or appealed claim is no longer than the initial submission time limit. However, this varies by payer. Make sure you understand these limits prior to working denials. So let's review a simple understanding of the revenue, a simple version of the revenue cycle. As you can see, it contains multiple processes that will generate the data from the transaction on the claim form. It begins with the patient contact for an appointment, if the part of a scheduled encounter, or at check-in, where the interaction with the patient is crucial to obtain all necessary information that will impact the rest of the transaction. The clinical visit generates the actual service provided and is documented and coded accordingly. If there are any specific data points that must be included in the documentation, including authorizations or referrals findings, must be accounted for by the provider. The pre-claims process that occurs next is driven by the setup of the EMR and assures that all claims data that is needed for the claim is present and ready to be submitted. It is the opportunity to make sure that the claim information is present and correct. It includes payer nuances, pricing for services rendered. The EMR should flag any claim that does not include that necessary data required for the proper processing. The billing process begins once the claim is released from your system and submitted to the payer, either electronic or paper, usually through a clearinghouse. At this point in time, the payer will accept the claim or reject it. Rejections are generated normally within 72 hours of submission, and denials begin to show up around the 7th to 10th day. The process for handling denials should be started as soon as they are received. Let's talk about the keys to fixing a claim. Once you have received the denial from the payer on an explanation of benefits or remittance advice, it will be important to start the denials management process, which is a lot easier than you think. To understand the reason it was denied, you must first understand the claim itself. First, review the claim and assess the claim details, what type of provider, what payer, what codes were used, etc. Understanding the claim information allows you to home in on payer rules and patient characteristic services provided. What was the denial for? Was it for a specific code or was it a global denial? In other words, should we be focusing on a specific claim line or the whole claim. Third, review the denial code provided by the payer. What does it mean, and are there supporting codes? It will take some research until some codes become second nature, which will occur over time. And finally, where was the error along the revenue cycle? Was it coding related? Did we miss a payer policy? Is it something else that we missed that was missed during the registration process? Fully understanding each of these questions will help resolve denials quickly and minimize risk of lost revenue. Let's take a closer look at these. First, claims detail. It is important to start at the beginning in denials work. You must first understand what the visit or encounter was for. This understanding is important regardless of the provider setting. You need to review all claims information first. A quick 1-2 minute assessment of the details will allow you to understand what were some of the potential reasons why a claim may have been denied, and that information is on the claim itself. Looking at the provider, where was the service performed? Who is the payer? And most importantly, what was done? You approach the denial for an E&M differently than you would on a complex surgery. If you are not aware of what all the codes and code sets are on a claim, I recommend you take the time to fill a claim form out by hand and understand where all of the data originates. Looking into the denial details. Understanding the codes on the remittance advice or EOB is important. Sometimes it will be easy to understand the reason and you can move forward with fixing denials quickly. Others will take more research and understanding. These code sets are labeled and are common to claims denials process. Adjustment groups tell us what happens when the codes that are with the codes that are being used. For example, CO means a contractual agreement. PR means a patient responsibility. Next, looking at the CARC or CARC codes, claims adjustment reason codes. This refers to the reason for the denial. An example will be provided to better understand this information. An RARC or remittance advice reason code gives more detail to the CARC and can clarify to the provider additional logic. All of these codes will be provided by the payer and provide insight to the reason for payments, denials, and any other adjudication on the claim. So let's take a second and let's actually review the CARC and the RARC and looking at the actual remit itself. So let's refer to it as this example that you see attached. This is a Medicare EOB. You would have the claim line total, the payment, contractual write-off, and any co-payer deductible associated with the charges. Normally, there is a glossary that will help us understand what the code definitions are. In this example, the claim was denied for CARC 16. The CO indicates it is a contractual adjustment, and the 16 is defined as a claim that lacks information for adjudication. This is a vague denial code, so it normally would be associated with another CARC or an RARC to help better understand the reason. In this case, the RARC tells us that the claim was invalid or incomplete. It was an incomplete bill type. Full list of codes can be found on the internet at x12.org. Website listed, which is the website listed above. In this site, you'll have access to all standardized code sets for review. It's a cool resource to have in your denials tool belt. So last, let's take a look at the impacted revenue cycle process. So identifying the correct process within the revenue cycle from which the denial was generated will help in at least two ways. It will assist with identifying the correct department in which the error was made. If you are missing the authorization number on a claim, you can contact that person or department responsible for obtaining the information necessary and determine if it is incorrect or missing. They can also tell you if there's an issue within the process itself. The second reason we need to understand the impacted error is to help identify if there is a process problem or system issue. By reviewing denial patterns, the provider will be able to address issues within the revenue cycle process to eliminate future denials of this type. So let's take a look at some common denial codes and how we could go about fixing the error to ensure that the claim can be resubmitted timely and without issue. Most denials within the patient access registration process have to do with demographic information or missing referral or authorization numbers. Clinical denials occur usually when there are coding and documentation issues and may require appeals and submission of records to substantiate the charges. Denials related to the pre-billing functions are a result of gaps in detailed claims review. Data is normally reviewed via an automated process in the clearinghouse or in the system the claim was generated. Billing denials occur after the claim has been submitted and accepted and denied in the payer system. They normally represent process errors and need to be worked timely to prevent claim filing issues. Each of these codes represents potential lost revenue and must be reviewed to ensure that the claim is accurate to the payer's request. So let's just take a second to review the denials management process. And to review denials and rejections, denials and rejections occur when a payer has not paid the expected amount for a submitted claim. They represent potential lost revenue and can have a big impact on the provider's bad debt expenditures. The revenue cycle represents the life cycle of a billed service, and a denial can originate from any process from patient access, HIM, or even follow-up on an existing bill. When working denials, it will be helpful to understand all aspects of the claim, which will help with reasoning what could have been denied and what are the potential fixes. Usage of standardized code sets called claims adjustment reason codes and remittance advice reason codes, remark codes, by the payer help understand what the reason is for the denial. Once you understand how to work denials, you can begin to work on a denials management program to help eliminate denials in the future and prevent potential revenue leakage. Last, let's look at some of the careers that are available to us from the HIM perspective. And there are many potential careers for HIM professionals in denials management. Working from the HIM department, you can be assigned coding denial follow-ups, also having a solid understanding of the billing process and specifically denials management. Data analytics plays a big role in denials management. Denials prevention is a large part of the revenue cycle process, and HIM staff can become charge master analysts, making sure that the charge master is kept up to date and in order. Also, reviewing payer rules and making sure that the EMRs are kept current is the role of the revenue integrity professional. Management careers that require a solid understanding of denials management include directorships, CFO, and even the chief data officer. Thank you so much for your time today. If you want to learn more, OHIMA has developed a revenue cycle hub for you to easily access information, videos, including today's video, as well as articles, careers, certifications, and education related to the revenue cycle. If you are interested in exploring a career in the revenue cycle or simply would like to learn more, please scan the QR code on the screen or visit ohima.org/revenue-cycle. All of OHIMA's information videos will be available under the Resources tab. Thank you for joining me today, and I hope you found the presentation helpful. I have included my email if you have any further questions or comments.